Now, while vaccines are on the way, hospitals are preparing to receive them. 41 Action News reporter Jordan Betts shares the plans to distribute them to our frontline workers.
The University of Kansas Health System says when the vaccine arrives, a certain department will get it straight away.
In our internal facility, we're prioritizing those who are going to have direct exposure to patients who have COVID-19. And so that really means the frontline workers who are actively taking care of COVID-19 patients. And whether that's a physician or a nurse or a dietitian or a social worker or a respiratory therapist, the CDC and HHS determine the number of doses by state. Then each state has its own team of folks who will look at that vaccination and the number they're going to get.
Kansas has 5 storage centers, one at the University of Kansas Health System.
Each hospital or local group, for example, for our hospital or for Stormont or for Via Christi, et cetera, we prioritize who we think, based upon the number of vaccine doses we get, we prioritize those on the number of people we're going to be able to give them to.
Healthcare workers will be among the first to receive the vaccine. National Nurses United says this relief is needed, but it should be just the start.
Nurses are tired and still fighting for basic protections, and the vaccine is not going to change our need for optimal PPE.
The union says educating communities about how we cannot let our guard down across the country will be critical.
Let us be clear. Nurses understand fully the value of vaccines, and that vaccination has saved countless lives.
Government officials say some states will receive shipments as early as Monday. In Kansas City, Jordan Betts, 41 Action News.